All right, hope everyone is having a good morning so far. Today is Thursday, April 28th. Our agenda today, a few repeat announcements, and then we'll do our COVID data update. We also have Anissa Taylor. She's one of our epidemiologists here today to talk about norovirus and give a quick update on that. And then we also have a guest from our community mental health and addiction team, Myra Jeffrey, here to chat a little bit about the opioid crisis, how it's affecting schools, and some information on Narcan in schools. And then we'll end the meeting with our usual Q&A. Just want to go over this slide again. This will be sent out in our weekly summary. A lot of the information that we go over in these meetings can be found at these resources, especially the CDC data tracker and community levels overview. If you haven't bookmarked that page already, I would recommend that you do so. Just two quick announcements. Want to mention again that we do have a survey that will be going out to everybody. We're hoping to collect some information on how you all feel like these meetings are going, what we can do to improve. We'll also be asking if folks will be working during the summer, if we should continue these meetings during the summer. Also, what other public health topics or school health topics you would like to see covered in these meetings. So be thinking about what we can do to make these meetings a good use of your time. We also are continually updating our contact list. We'll probably be sending out a new series of invites eventually. It might be renamed, might come from a different person. So if you were forwarded this invite, make sure you email schoolsupport@pima.gov. Let us know that you'd like to be added to the official invite. And Connie Johnson couldn't make it today. She's in training this week, but she will be taking over these meetings hopefully starting next week. And you can reach her at our school support email, or her direct email is constance.johnson@pima.gov. All right. How are we doing in Pima County? The good news is we're still at a low community level, so we are still in the green. Most of the country actually is in the green right now, except for if you look at New York, they're not doing so good on the East Coast. Our rates decreased quite a bit in the last 7 days, down 71.5%. We also noticed that testing has also gone down though, 40%. The last 7 days, we had 212 cases in Pima County. That brings us to a rate of 20.24 cases per 100,000 people. We currently have a 5.02% test positivity rate, and our current vaccination rate is at 73.1%. So that's a good number, though we would like to see that go up, of course. So we continue to recommend that people get vaccinated. If you know of families or students that still haven't received their vaccines, we're still encouraging that. As for the cases that were reported to the health department from the schools, this is what we're looking at. So, I mean, compared to, early in January, we were seeing hundreds of cases per day. So we're in the single digits on some days, which is really good. Of course, these are the cases that the schools are reporting through the line list and the portal. So it doesn't take into account any positive cases that aren't being reported by schools. If you were to go to the CDC community level tracker page, this is what you would see. Still in the green, so that's the good news. Not a whole lot new here. That actually does it for COVID, so mostly good news this week. Up next, we have Anissa Taylor. If you're on, Anissa, she's going to share just briefly about norovirus.
Hi, good morning, everybody. Yes, I believe I had a couple of slides to go over for Noro.
Yes.
Okay, great. Thank you so much. So this is just a really brief recap of the presentation that Lauren from Consumer Health and Food Safety, she's one of our environmental specialists and investigators with that program, and I had done about a month ago or so, maybe now. So this is, again, just to reiterate, we're in norovirus season. Unfortunately, we're starting to see wide community spread. I'm sure you've heard about it from family and friends in terms of, oh, we've got the stomach bug. It's going around in childcare centers and schools. We're working multiple outbreaks right now in all age levels, everything from pre-K all the way up to our seniors, unfortunately, which are our most vulnerable population for this illness, only because with them they have comorbidities. They tend to be more immune compromised and can, have really bad results from dehydration. So that's something to keep in mind with your population. They may be young and healthy, and which is great for that virus to spread. It's a hardy virus. It's a non-envelope virus, which may not mean a lot to you, but on this side, it means that it can live a long time. It can be rehydrated on surfaces. It can live on an unclean surface for 2 weeks. So if you think about a tiny little piece of vomitus that's aerosolized or fecal matter, that can spread really well. So that hand touching high surface area, those should be cleaned frequently in classrooms and in the buildings. Again, so this means that it can be rehydrated. So if you even have surfaces outside, front doorknobs to the school entry, gate entries, anything where there's high touch, that we don't think about cleaning, that could easily be a reservoir for norovirus. This little, I forgot what this is called because I'm not as tech savvy, but you can use your camera for this code here, and it'll give you the EPA list of agents effective against norovirus. I tried it out. It's actually pretty cool. So we can ask to send this slide out to everyone if you want. These are just some quick facts on the statistics of norovirus. So again, this isn't really respiratory spread. So although masks are great for COVID and influenza that's circulating right now as well, it's really the hand touch. So really good hand washing. I mean, if there's a way we can monitor hand washing in class or go over that with the kids, that's really, really important, getting under those fingernails. And then when they go visit, their grandparents, grandma, grandpa, nana, tata in their nursing homes, long-term care, they're not going to bring this virus with them, and vice versa, and bring it back to the household and back to the classroom. So if you notice any outbreaks, increased threshold of cases going on, please feel free to give epidemiology a call. We can provide you with the GI toolkit. I believe I sent that last time as an attachment. If not, I can send it to you directly. You can contact Matt for my information and the epidemiology program. We do have someone for after hours and over the weekends if it's an emergency only, of course. If not, we will take care of this during business hours and get you all the resources you need. And we ask for the same thing similarly to COVID in terms of line lists. It's really important for us. We have to report these outbreaks to our state health department. They report to the CDC. Of course, everything's de-identified, but we need numbers. We need how many people are in the class, how many people are infected. Those things are really important for us to have. So we appreciate all of your help. I won't keep you any longer unless you have any questions. Thank you.
Thank you, Anissa. Does anybody have any questions for Anissa regarding norovirus or how to report it? If you think of any, you can always enter them in the chat or email us after the meeting. We'll make sure to get those answered for you. All right, up next, Myra, are you here?
I am. Is my mic working? I should just start with that.
Wonderful. Yes, we can hear
Okay.
you.
Hi, everyone. Yes, I also do have slides. So just to introduce myself, Myra Jeffrey. I'm a program manager with the Community Mental Health and Addiction team. And I just really want to talk to you all very briefly about how we can work together to end overdoses, overdose deaths specifically. So next slide. So typically when we start a discussion about overdose deaths and just Narcan in general, basically all of our presentations, we like to start with some data. ADHS has been tracking the number of opioid-related overdose deaths since June 15th of 2017, when the governor declared a state of emergency in Arizona. So this is public information. This is public facing. This is called the Arizona Opioid Dashboard on azdhs.gov. So in the last 5 years, 10,000 Arizonans have died from an opioid-related overdose. And almost that we suspect almost 5 times as many individuals suffered from a suspected opioid overdose, but they did not die. And while they survived, a lot of these survivors were left with side effects that they will suffer from for the rest of their lives. Now, I see a comment in the chat. Is anybody else having trouble hearing me? Do I need to project a little louder?
It is coming through slightly muffled on my end, Myra.
Okay.
Looks like other folks too. Yeah.
Okay, let me do something because I see the problem there. Now, how about now?
That's much better.
Great. I was using the wrong microphone, so sorry about that, guys. Hope you can hear me a lot better now. So yes, 5 times as many individuals suffered. So approximately 50,000 people in Arizona over the last 5 years has suffered from an opioid overdose but did not die. And like I was saying, a lot of those people were left with these side effects that they're going to live with the rest of their lives. And one really incredibly important reason why a lot of these individuals survived is because of a life-saving antidote that I'll talk more about in a moment. So let's look at the next slide. This is a little bit more data specifically about our community. I know you guys are more worried about maybe your students or maybe school staff, but let's look at the community as a whole in Pima County. Last year, we hit unfortunately, another deadly record. So this is 3 years in a row. The number, this is not final. You'll see that little asterisk there. The confirmed number so far is 497 for all of 2021. And it's really incredibly important to note also that we've seen an increase in racial disparities among overdose deaths. This was further exacerbated in 2020, with overdose death rates substantially increasing in both Black and African Americans and American Indian Alaska Natives. Let's go to the next slide. So I want to show you here the overdose deaths trends for the last 10 years. So note, sort of in those first, I'll say 8 years, kind of a level, stable, maybe a slight uptick in those overdose deaths, and a really accelerated increase in the last 3 of those years. So far, I can tell you that in 2021, we're on pace to meet, at least meet the last number, what you're seeing for 2021, the end of year total there. Next slide. So this is specifically by age group. So we did see some deaths over the last 3 years in those 12 and under. Really heartbreaking for me, just because of all of those years, though those numbers may seem small, lots of life and years lost, and just the impact to the support and the families and the community as a whole. Really unfortunate there. Some examples of why we might be seeing numbers rising in these different age groups, I'll say. In young adults, this was really common maybe a few years ago, probably still so. Young adults were experimenting by mixing opioid medications with other substances in what they were called pill parties or farming or Skittles parties. Essentially, they would dump medications that they found or raided from home, from medicine, their family's medicine cabinets, grandparents' medicine cabinets, put them in a big punch bowl and have a party, experiment by taking those medications. So that's what they call the Skittles parties. In most age groups, this is true that a lot of the usage of opioids and just these medications started off as pain management, which later became addiction. And more specifically in older adults, and actually for 2022, we're seeing quite a bit of an increase in the older 60 to 79 age group with intentional overdoses. With older adults, they're very often being prescribed multiple medications, and sometimes they might be accidentally mixing them or taking more than they should be. So you'll see kind of which age groups in that graph there are increasing. In any one of these age groups, any one death related to an overdose is too many. Let's go to the next slide. So you're probably thinking or more concerned, how does this relate to students in our schools? Pain relievers are most frequently abused, the abused prescription drug amongst youth in Pima County. This is a little bit old. I'll say that the statement is maybe a little bit old. It's still true, perhaps, but we're seeing a lot of different things right now. So this is from a youth survey in 2018. So on average, one student in every middle and high school classroom reported using prescription painkillers without a prescription in the last 30 days. Now, I don't know how many people that is shocking to, but it definitely was to me. And as I can reiterate, really serious problem for school-age youth that we need to address. So I'm just going to quiz you. Let's go to the next slide. I want to see, I don't think anybody's showing me their faces, their camera, but maybe in the chat, I'm going to open up my chat window. I want you all to tell me which one of these is real and which one of these is fake. And if you know what this medication is, it's oxycodone, labeled and stamped with an A and 215. Tell me, number one or number two, which one is real, which one is fake? One is real. Anybody else think differently? One is fake, one real, two fake. Okay. I see a lot of like different answers, right? And that should probably already be scary, is that maybe we can't really tell the difference, but I am maybe seeing a little bit more that you're thinking that number two is real. And that is false, actually. We pulled number one is from CVS Pharmacy. And number two is actually a picture from TPD, from one of their seizures. So this is directly from TPD number two. Really, really scary how real that looks. And in that number two, in that seizure, this is not oxycodone. This is a counterfeit pill that contains fentanyl. So this is exactly what illicit drug manufacturers are trying to do. They're trying, and they're not only trying, they're becoming really successful at it. It's really hard to tell the difference. They're trying to make this pill look as real as possible, so people think that somebody got it from a pharmacy, or perhaps from another drugstore. But they do this because people feel really comfortable if they know that their medication or what they're using or experimenting with came from a reputable source. But in reality, it's really hard to tell the difference. There's no way to taste the difference, to smell, to observe any differences in this counterfeit pill. Really, the only way to tell if it is counterfeit or if it has fentanyl is by using a fentanyl test strip. So really, really scary. And in fact, even with the fentanyl test strip, you won't even be able to tell the amount of fentanyl that is in that this pill is laced with. So fake pills are just really incredibly cheap and incredibly easy to get a hold of right now. And again, going back to what I just mentioned in the previous slide, if you think about kids experimenting in those pill parties, and this is in the mix, is in the bowl, really, really dangerous things are happening. So let's go to the next slide real quick. This graph is showing you those trends in 4, perhaps the highest substances related to deaths that are leading to deaths in Pima County. So as you can see, fentanyl started out of nothing. And a really accelerated increase in fentanyl, it has taken over what is circulating in the community, and it is the #1 drug contributing to overdose deaths. Next slide. I'll tell you very quickly that fentanyl is incredibly, incredibly lethal. It is 50 times more potent than heroin and 100 times more potent than morphine. Next slide. Now, I showed you a pill, right? Let me just show you what the amount of a lethal dose of fentanyl is. So you'll see a lethal dose of heroin on your left, fentanyl right there in the center, and even worse, carfentanil in your right. And this is, guys, this is a lethal dose. So if you imagine this amount is very easily disguised in a pressed pill. And in a pressed pill, the problem with fentanyl is that you don't really know the exact spot on a counterfeit pill that it is located. Fentanyl really easily binds with each other. So this is what they call the cookie, the chocolate chip cookie effect, is that in a certain piece, people try to kind of experiment by cutting a pill in half, and that's not always accurate because it could bind to the entire one half of a pill, and then you've got that whole lethal dose, whereas the other one might not have as much. So kind of a false sense of security if someone took the other half and didn't experience an overdose, that where the other half had all the fentanyl. So let's go to the next slide real quick. I'll move a little bit further, faster here. But one thing we know is that the youth who learn about the risk of drugs from their parents, guardians, or any adult role model, they're all significantly less likely to use drugs. In fact, only 53.7% of our young people say that parents never actually talk to them about any drug. So 53% of them haven't had that conversation with their parents. Really scary. And next slide. Really easy to get a hold of these medications or these drugs. A lot of kids, you can see you can see the number of doctor, pharmacy, how much was actually prescribed to them. They're getting it from all of these different places, from friends, from their families' cabinets, these parties that I just mentioned, maybe even sharing in school, and the internet. This was a really big, more recently too, is getting illicit fentanyl medications, drugs, just being able to get it in like Snapchat and other areas. So what can we do? Next slide. We want to take some action. So of course, if you have any of these medications at home that you don't use, don't keep them there, discard them safely, don't flush them, mix them with coffee grounds or cat litter and water, and you can throw them in the trash that way. You want to understand all of the Good Samaritan laws. We want to get trained to respond to an overdose. We can help with that. Carry Narcan and know all the resources in your community. So let me tell you about where to get Narcan in the next slide. Please visit pima.gov/naloxone. We've got an embedded map there. This is this is what we call our community distribution sites. All the locations where you could get Narcan for free. And you'll see that all of the Pima County libraries are on these maps, our public health clinics as well, and a few other partners are on the slide. Next slide. If you could help me share the message. So we've got some posters you can put up for us, alerting everybody on how deadly and deceiving these pills are and how lethal they are, how naloxone saves lives, and the QR code is going to take them straight to that website, to Pima Helpline, actually, to the embedded map as well on where to get free Narcan. And a little bit about the resources available. So the next slide tells you, shows you Pima Helpline. This is a really great site to try to find some treatment providers in our community. We keep tabs on this site, make sure it's always current. The online resources is going to have a few other things about, like I just mentioned, the Narcan, but resources specific to tribes or needle exchange programs, that sort of thing. And the next slide is something I can distribute via email if you'd like, but this is just a quick one-page resource that you can share with anybody that might be struggling or needs help. 24 hours a day for most of these resources, but they're all crisis lines or warm lines. Also, a little plug there for us on how to reach us if you need us for anything. A little bit more about our team and what we have to offer as far as education and training on the next slide. We do, like I said, offer the Narcan training. We also have staff trained to deliver the QPR Gatekeeper training for suicide prevention, mental health first aid for both youth and adult, and a few other things that you might be interested that'll help get that conversation started with your kids. So a lot of these programs can be like a 55-minute block where we come in just to the classroom and talk to the kids about either RX360, which is a lot of these similar slides that I just went over, NAMI ending the silence to reduce stigma, and stress management. So I know you only have probably 3 minutes left, but I want to give you time for any questions or any discussion you guys want to have. I'll give you my contact information there.
Myra?
Yes.
So you said you do come out to the schools to talk to students?
Yes, absolutely.
What grades do you guys target?
Typically late elementary, so more frequently middle and high school. But we can do like 5th, 6th grade sort of elementary.
So, okay, so 5th and up or 6th and up?
Yeah, yep.
Okay. And then we would just call you to schedule maybe something for next year. We're almost done with school this year.
Right. Absolutely. Yes, you can feel free to reach out to me directly or to that cmha@pima.gov email that goes to the entire team, including myself and the individuals that are responsible for coordinating the outreach. But as far as the website, if you're looking for the website specifically for Naloxone, it's pima.gov/Naloxone. Pima.gov on your page here, pima.gov/mental health. Takes you straight to our team's main site. So anything you want to learn about our team, we've got data surveillance and a dedicated epidemiologist that does the surveillance for fatal and non-fatal overdoses and suicides. We do overdose fatality and suicide mortality review committees that meet quarterly. Case management, we actually offer case management services as well for 18 and over individuals who are at highest risk for an overdose. A lot of this outreach and trainings presentations that I told you about, and sort of you can just kind of see how we've talked in the media. We've done a lot of stuff in the media as well.
All right. Well, Myra, thank you very, very much for presenting. As everyone can see, our team here at the health department is very willing to come out and help educate the community. So if you'd like to get in touch with Myra, this entire slide deck will be sent out in an email, most likely this afternoon or tomorrow. So all the information will be there. Our time is up, but I'll be happy to stay on for 1 or 2 more minutes if anyone else has more questions they'd like to ask. Otherwise, want to thank you all for joining us today. Have a great rest of your week. Thank you.